So we have new functionalities available in order to complete some of the tracks that we have available for this year. So, first of all, let's have a brief review of the different tracks. In particular, track 1. We're going to focus on that, but we're also going to check the application, or the first version of the application that we shared with you a few weeks ago, so that then we can go and focus on the important and new parts that come with this new version. So, as you remember, track 1 is one single patient who is going to travel through different countries in Latin America and the Caribbean, and before leaving the country of origin, they receive their IPS, their International Patient Summary, from the country node of origin, and it is saved in the application that we are developing. Then, when he goes abroad, the patient can receive medical attention which is in a different country from the country of origin. And during this service, the patient can share their IPS with the new care provider using VHL, choosing the resources that they want to share, and then the care provider can scan the QR code, obtain the IPS, and therefore have access to the patient's clinical information. And also, after the service has been provided, a new clinical document can be created with the new information for that patient, which can also be shared as a VHL, and then the patient will be able to scan that VHL, read their information, and then update the clinical summary. Until the previous session of the application, we covered the first 3 bullets. We could get the IPS, save it in the application, and create the VHL with the resources desired. And now we're going to focus on the last bullet, which is the new update, and that is how to scan a VHL from a new country and to merge it with the IPS information that we already have. So just to remember, this is in detail the different tracks for this year. We will also go through this very quickly because we have already reviewed it before. This first part is the creation of the IPS LAC, which is what most of you are already doing in your information systems. And here is where the IPS is created. Then, this is where the application comes into play. We can get it from the country node with a local ITI 67 and 68 transactions. And then with that, we can select the resources that we want to share. We can therefore have an IPS with these resources, and again, using the node services, it can be signed, and then the VHL is retrieved as a QR code, which is saved in the application. That is what we have seen so far. This VHL, as we all know, can be shared with other healthcare providers, and let's say that we are now in another country, member state B, country B, and this country's health information system can scan this VHL code, Obviously, it can decode it, it can verify the signature, and it can use the passcode, and it can get to the IPS that the patient shared. And this is the new part, really. So in country B, where I'm receiving, or the patient is receiving a healthcare service, as we have said before, we might receive new important medical, clinical information that can be shared with the patient. So here, the country B's system generates a new IPS for this patient, for that healthcare encounter in particular. So this new IPS, also using the country node, can be translated into a VHL, and that VHL can be scanned by the application. This is the new step that we're going to take a look at right away. And so the application now works in the reverse order. It scans the VHL, it will search for the information that is part of that VHL, it carries out the necessary requests with the country code, country B node, it verifies the signatures, and it gets the URL for the IPS, and then we get the final IPS, which the application locally records, and it's saved. So this is the first part of the new things that we have in this latest version, which is the possibility of scanning a VHL and getting the associated or the corresponding VHL. But now we have a challenge, which is in the application previously, as we saw here, we have an IPS which comes from the country's country of origin. That's the original IPS, let's say. And with this new scan of the VHL, we have a new IPS, which is different to the original IPS. So now we have two IPSs for the same patient. So the challenge is how to merge these two IPSs in one sole or unique IPS, which we have called a combined, merged, or consolidated IPS, which has the original IPS information and also the new IPS information coming from country B, where we have received the new healthcare attention. So for this, in the applications backend, as we can see on this chart, we have a mechanism in order to carry out this merge. The combination, basically, the application receives the two IPSs, two separate documents, and it carries out a procedure, and it checks resource by resource. If there is a new resource in this new IPS B, it is added to the original IPS, and then that is done resource by resource for all the resources, and it creates this new combined or merged IPS, which is returned to the application, and which is the one that the patient has as the latest version of the clinical status in the application. So with this new consolidated IPS, the patient can again select if they wanted, for example, to share this new IPS's information again, they can do it by now selecting the information that they want to share. That creates a new IPS with this selection, which can also then be translated into a VHL and obtain a new QR code for that selected information. And this process can be repeated as many times as required. So this is basically the new part. These last two slides that I have just shown you, these are the new parts that this new update brings. So you may recall, this is a slide from the previous presentation. The application, as we had originally mentioned, had a few functionalities. For example, recording the consultation data using a QR code is basically scanning it and then sharing this new data through a QR code, which is a VHL. Just for us to recall the architecture of the application, it works like this. We have the application per se, which is what's running on the mobile phone. We have the application backend, which is made up of two parts. The backend itself, which is the service that has all the infrastructure in order to get the IPSs, the VHLs, and we also have here the mechanism to merge them. And we have the authentication server, which authorizes the users. Because remember that an important part is that this is a user-centered application, and therefore users need to log in or need to register in this application, and that's how they can access their information. And again, this part also communicates with the country node, and especially with the FHIR servers and also the VHL service. So again, for all of this to really work, one of the previous requirements is that the country code has got to be in the latest version and these services have got to be up and running. The keys have got to be valid in order to create VHLs. That is a must. So here we have a couple of more diagrams of service interactions, and I'm going to go through them very quickly because I want to go into this one in particular, which is the new one that is being implemented. So this chart just simplifies the different components and takes a look at the case that we were just seeing, which is scanning a QR code. So it works like this. The user using the application will scan a QR code with the device, with the mobile device. They go, they scan the code, and then they get the contents. With the QR content that has just been scanned, it'll carry out a request to the application backend with that content plus the user token in order to authenticate who it is. The application backend will carry out several activities. Among them, it'll first validate that the user is who they say they are, and that the QR code that is reading also matches that person. And then with the QR content, which is a VHL, they will interact with the other country's node where this new QR code was created in order to verify the VHL content, the signature and the manifest. And then with that, they will get the IPS information. Once it has the IPS information, it'll carry out the merge that we have been talking about. The application backend knows the content of the IPS that the user has in the application, and together with the new IPS that is coming from this service are merged and it's sent back. So basically the backend carries out these 5 steps in this transaction. The first thing is it verifies the user's token to make sure that it is the right person. Secondly, it decodes the content of the VHL in order to get the corresponding payload. With the payload, it verifies the signature. That's something that the application does. So, for example, if the VHL is created with a key that is not part of the trust list, or of the WHO trust list, it will be rejected. So this is a signature verification step. And if the signature is okay, then it obtains the IPS that is stored in this VHL using the link that is contained in the payload. And with that IPS, it carries out the last step, which is the combination, the merging of the latest IPS together with the original IPS, and that's what is sent back to the application. So, just to make sure that this is absolutely clear, I want to share with you how the application works in this new version. And for this, I will share my mobile phone's screen. Give me just a couple of seconds in order to activate it. You've stopped sharing your screen. Okay. All right, you should be able to see my mobile phone there. Okay, so I'm directly connected to my phone. That's all I have in my phone. And as always, let me first look for the application. Here it is. So as I was saying, as always, most applications work like this, and most of you have already seen it and you've been able to work with it. We have the possibility of creating an account or logging in. I'm going to log in with an account that I have made for these purposes. Okay, there's something here that does not allow me to click in login. Bear with me just a second. Bear with me just a second, please. Yes, my mobile phone got disconnected, so I'm going to take a little bit of time in sharing this again. I'm connecting it again. My apologies. Alright, you should be able to see it now. So I'm in the application here again, and as I was just saying, I'm going to log in with an account that I have already prepared for these purposes. So you know the login procedure. You have to put your identifier there and your password. I have a testing user, which is the one that I will be using here. And as we saw last time, since it's the first time that I've logged in the application with this user, it's empty. It's empty. So what I have to do the first time is to click on this button here that says load from health provider. And this carries out the request to the national node in order to get the IPS using the ITI 67 and ITI 68 transactions. It carries out the request and then it retrieves it. There's a small viewer here in the IPS, so we can see here the IPS that has condition, it has 2 allergies, then we have 1 medication and 1 immunization. So this we saw in the past. Now, with the button share, we can share then the VHL. Let's say then that I want to share this clinical data. I can select some of them, and when clicking on generate QR code at the bottom, it will create an IPS with the items selected, and it'll be transformed into a VHL. I've just clicked on it, and obviously this is all very fast, but on the back end, the back end is carrying out all of the requests and all the logic behind it. So with this VHL, which is in my device, if I were to go to another country following the user case that we've been talking about, I can show then this QR code to a care provider, and that healthcare provider would have access then to my clinical information. And so they can learn about my health condition. So let's say that I'm in another country now, and I'm receiving a new healthcare service, and in that new country's health information system, let me see if I can show you this. Hold on. So continuing with the case use, I've gone to another country, as I was saying, and let's say that this is the other country's information system, and they tell me, after having evaluated me, this is the new medication and this is a new allergy that has been diagnosed. So in the country's information system, VHL can be created. So this is obviously just a mock-up that I've put together for these purposes. And the VHL for this new information is created. So again, I've shown you the QR code in the application. They read it. I got the healthcare service. These are the new things that have been identified, and they are transformed, or they are part of a new IPS, and they are shared. They can be shared through this new VHL. This is in country B. So now, if I come back to the application, what I would like to do now is to get that information, this new information that is in the new country's information. It's in a VHL, but I want to add it to my clinical summary. So for this, we have a button here at the bottom which says Scan QR Code, which was also in the previous version of the application, but it wasn't enabled. And now it has been enabled. So if I click on it, I can, as you can see, it opens up my device's camera. And I can see exactly here what I was just sharing with you. And I can scan then the VHL. I have just pointed at it with my camera. I hope that you were able to see it. I scanned it. And in the application, I can now see the information that QR code had. So I have just scanned it. The application immediately decodes the QR code. It verifies the signature, it obtains the IPS, and that is the IPS that's being deployed here, which has these two new components that I just showed you, a new allergy and a new medication. And I can here decide whether to save it or to cancel it. Let's say that I read the wrong IPS and then I could cancel it. Now, normally what should happen is that we should save it. So if I click here on Save, what it's actually going to do is that the merging of the two IPSs should be carried out. This is the new one, and it'll be combined with the other one that had several other components, and now they will be merged. And in my device, I will have one single IPS, but that is a combination, that is consolidated. So let me click on Save, and all that I have just described happens. It's all very fast. The systems work very efficiently, as you can see. But now you can see then that in the main view in the application, I have this new combined IPS. In allergies, we have now the new allergy, which is the one at the bottom, which wasn't in the original IPS, but it is there together with the previous ones. The same thing with medications. I used to have one, and now I have two, including the new medication of this new medication that I have just scanned from the VHL, and the rest of the resources are unchanged. So here in the application, I will have the combination that corresponds to the latest version of my clinical record, which has all the information from the original IPS and the new ones that I have scanned. And I could repeat this loop once again. If I click there at the bottom of scan QR code, I could scan the new healthcare service if it took place, and it'll be adding more information as new QR codes are scanned. And as we saw before in some of the charts, I can also share now this new information using a VHL, just as we did at the beginning with the original IPS. I can do it from this new combined IPS. If I click on share, you can see now that in the list of resources that is deployed, I have all the information, including the new one that has been added, which came from the new VHL. So with this, I can then control what I want to share and what I do not want to share with the next healthcare provider. The important thing is that in my device, I will have all the information stored. It's all available. You can see that in the merge step, it did not ask me if I wanted to share all or only part of the components, because by default, it'll always include them all, and it is only when I decide to share where I can select which ones I want to share and which ones I do not. So, for example, I could share the new medication, the new allergy, and then also my immunization, and that would create the new VHL code, which is different to the previous one, which only has the information that I have just selected. And I could then share that with a new care provider and repeating the circle many times. And as always, here in my application, in my home page, I will have the latest version. We keep the combination, which means that I have all the resources available. So that is basically the new functionality in the application, the possibility of scanning the QR codes and merging the new IPS with the original one. So let me go back to the slide deck. So here we have just seen a demonstration of scanning and merging two IPSs, and if you check track 1, you will see that all the components are there ready with this new update, which would allow you to complete 100% of the activities in track 1. I would just like to remind you that these are the repository URLs. The update of this version will be launched today. We wanted to have it before this presentation, but some details were missing. But it will be available now in just a couple of more hours. And in the same repositories as before. The application is in this URL. When I'm talking about the application, I'm talking about the mobile application, and the backend is here. And as we also told you in the previous presentation, this is a template because you need to fill out some parts. Basically, the connection or the call to the fire services or VHL services. So this is just a reminder of the repositories and the local environments for development that has several steps. and that which were all described in detail in the previous presentation. So, as I was saying then, with this we can complete track 1. And if you update the new version, if you update to the new version of the application, and with all of these services running, you would be or should be able to carry out all of the services for track 1. But the application also is a part of track 2. And that's what I would like to tell you about in this next part of the presentation. So, track 2, for us to remember, this is a chart to depict it, has to do with vaccination certificates. And as we saw in the previous webinar, we're going to use the ICVP certificates. The national node have been updated. You need to update it to use these new services. So the first thing that you need to do is to create this IPS DVC, which follow the structure of ICVP for immunizations. So this is what we were mentioning in the previous week webinar, so I'm not going to go into the details of this, but the important thing is that this part comes now from these IPS DVC. We can get to the ICVP certificates. As we showed in the webinar last week, we carried out a demo on how this could be done. And we've also facilitated a transformation from IPS to these ICVP codes, which are also signed. So this is what we saw last week. But then the new part begins here, which also includes the application as a device to be used in the case. Similar then to track 1, the patient then from the application will be able to create the ICVP certificates, and that's what we want to test in this user case. So for this, the procedure in order to create ICVP is very similar. You have to get to the FHIR server, get the IPS, and with the IPS then they make a request to the country node in order to create the ICVP certificate for the immunization and to have it deployed in the application. So that is the first part, which is issuing the ICVP from the application. With that ICVP, just like in track 1, you can store it in your application and you can share it in a different country. This is member state B, country B, and there they will be able to scan it. I will talk about some details later on, but this would allow them to have then access to the ICVP information. So it's a similar case to the previous one, but instead of a VHL, this is the ICVP certificate. So something similar here can happen to what we saw in track 1, where in a different country from that of the country origin, we could get an immunization, and that immunization is later translated or transformed into an IPS, which will have the ICVP structure, which will allow me to have an ICVP certificate in the form of a QR code issued by country B. This ICVP certificate, and this is the other part of what the application does, can be scanned in order to store it in my device. So here we simply scan it, and the application will work like a repository where we can persist with the ICVP code, and we can share it again if ever needed. So it's similar to the one that we've just saw, because there's no merge and nothing complicated behind it. Simply we get a QR code, we can scan it and store it in the application. So the app for track 2 will work in the following way. Here I'm just showing you with these mock-ups, because this part is not yet available, is still being developed. But basically the changes will be the following. So in the IPS view, under immunizations that have the ICVP structure, we will have this button, which is the QR code button, and if you click on it, it will create the ICVP code associated to that immunization. So with that, we would complete the first part of the track, which is issuing an ICVP from the IPS that we have in the application. And in order to do the second part of the track that I just talked to you about, there's also going to be the button for scanning a QR code. We're thinking about using the same button that is used for scanning the VHL and for the application to be able to tell which one it is, so that the use is as easy as possible. And here, that same QR code would persist in the application, and it can be stored. And therefore, I would also be able to share it again if necessary. So it gives you the message that is stored once you save it. So these are the latest two functionalities which are still being developed by the team. And we will give you an update which will be the latest update, or the last update of the application, but in a couple of more weeks, where we will have this last part. But it's actually easier, simpler than track 1, and these are functionalities that are shared, creating a QR code and reading a QR code. So in bringing this to an end, let me tell you some of the next steps. So the first thing that you have to do is to update the application repository to the latest version. As I have said, the version will be up there, available in a couple of more hours in the GitHubs that I have just shared with you, and you will be able then to work with it. If you haven't started working with the application yet, then the recommendation is to start with this latest version, because it will have all the changes that we have just seen, and some of the previous ads, or all the other ads too. If you've already started working with the application and you have made a lot of changes, because we know that some of you have already started customizing it and including some additional functionalities, then what you can do is to see what the new views that, and based on the commit that we're going to have that will have the changes, and you can adapt then the necessary things in your own version. If you have already started working and you haven't made many changes, then you could update it to the latest version and you will probably not have any major conflicts. So you shouldn't have any problems with the update. But if you have already been working and you have changed some parts, it is probably better to see what these new elements do then and adapt it to what you already have. As always, as a team of monitors, we will be available for any doubts that you may have when doing this. When you update the application and it's running correctly, what we will ask you to do is to verify the new user cases. And as I have repeated several times, you can test the full circuit similar to the one that I have just shown you with all the steps, and in particular for track 1. This is important to check that everything that you have done for creating the IPS and VHL has been correctly done, and also the parts where you had to fill out in the backend that were empty. As always, you can customize the application according to your institution's logos or colors. You can change certain flows if so you wish. That obviously is something that you can do. But I recommend that you do that once you have completed the circuit and once you have made sure that everything is running smoothly. And then lastly, you will have to implement the changes in the app for track 2, which is what I showed you just now. And as I said, a new version then will be released in the coming weeks. I think about 2 more weeks it'll probably be available with all the changes that I have mentioned, so that we can carry out track 2. So these are the next steps for the application. And this is the last update that we're going to carry out for track 2. And then with that, you will have then the tools available to solve both tracks during the Conectaton. You only have to deploy it in your own environments and test it. So that is my presentation, and we still have a few minutes for any doubts. I can see that there are some questions in the chat pod. Yes, I'm reading a question from Christian here. If we download the code, it already has the one from track 1, and do we have to change the URLs or do we have to merge them? It's actually a good question. The possibility of combining IPS will come as part of the application's backend. That is to say, it's not something that we will be asking you to do the search, the ITI transactions. No, they will be available. It's an endpoint. You get 2 IPSs and it'll simply retrieve an IPS with the merge. So it's very simple how to use it. the application calls that endpoint, so you don't even have to worry about that. It's simply downloading this. What you do have to complete, as we were saying in the previous presentation, are the searches, because you need to know how to search by document reference when we have an IPS and how to create a VHL. But the merge, the combination, is not something that we're asking of you. It's a little bit of a more complex operation, and it's really not part of a standard yet. There are some definitions, but we are using only one of them, but it's not something that is standardized. So we would rather give it to you ready, and you simply run it. The next question says creating the VHL from the HIS must have the same dynamic as the app. Selecting what to share. Well, that's also a good question. Let's see. For what we have just seen, I showed you that the IPS that the second country creates is for that attention, for that new care service that has been provided. That's the way that we have considered it for this part. You can see that we're not using the broadcast, or we're not communicating one node against the other. It's simply a communication that takes place through the VHL, and that's why the VHLs are for that encounter in particular. Yeah, let me support you a little bit with that, because although it is true that when you go to the definition of the VHL, where the profile or the selection of the data that you choose that you want to translate into a VHL, as well as the password, these are part of the VHL characteristics but from the point of view of the process and how we want to put this in the test, from the country systems, it really makes no sense to carry out that selection, because it is the case use for a cross-border service, and it's something that we need, but all the data associated for the health services that the patient is receiving is given to them only. So it really makes no sense to have this from one country platform and to select some of the fields from that and then to have that information provided to the patient. As a patient, we are interested in having all the data and then having the data for that clinical service, in particular, whether it's an allergy or a surgery in particular, just to say something. But from the point of view of the app and as a patient, we share the information, and that is the consent. And from that sense, it really makes sense from that point of view. I'm sharing this data and I consent to share that data in particular with some of the other healthcare providers, which are probably healthcare providers from a different country. I think that in a sense this also answers the question. From the point of view of the health systems, it's not necessary to carry out the selection at that level. They have to give all the information to the patient. But from the point of view of the patient, the patient consents what information they want to share. That is right. Thank you, Carlos. The next question is if we can share the links for the repositories. Yes, well, as always, this video will be available in the YouTube channel, and the presentation, the slide deck, will also be shared. The next question is, the National Backend IPS, has it had any updates in the last few days? Or is it only for... Let's see. The last update to the national node took place last week when we presented the ICVP certificates for vaccination with the new definition for this year. And that same day, after last week, that's when the latest update took place. If you haven't updated it since then, you need to do so. Not for this that I shared for track 1, but for what's coming for track 2. So that it works well, you have to have the latest version of that service. Are there any other questions? Well, we still have a few minutes left. You may raise your hand if you want to do so. You don't necessarily have to write it in the chat pod. Let me just add the information related to the update of the Docker. Everything that has to do with the vaccination certificates and why that is for the next app release, well, it's because there are many definitions that we have been defining together with the WHO. Remember that the WHO are the ones who have developed the ICVP profile. So this year we're going to try to work as closely as possible to the latest definition, taking into consideration that later, when going into production with the yellow fever certificates, is not as different. Since last year up to this year, many things have changed in the definition. I mean, small changes but have a big impact. For example, the vaccination codes. Last year we were using ICD-11, and this year there's a new coding for vaccinations that have been pre-qualified to be a part of these certificates. So the goal is to be as close as possible to this. There are some things that are still to be defined by the WHO, and we have had to make decisions based on that, but always with the spirit of being as close to that as possible, so that when we do want to go into production, then the gap is not as big. That has also meant that we've had to delay the vaccination certificates a little bit in the app, but it will be ready soon. And the mechanism, as Sergio has just explained, is the same one as track 1. It's actually easier, which is the great thing about the QR code and the vaccination certificate, and that is that the information is there and we don't have to go and search for it. It doesn't have the VHL mechanism. It's simply a new way of representing the information with a much simpler approach, but very useful. Anything else? Any doubts? Please raise your hand if you need to say anything. I want to emphasize that you have to catch up with the activities. You know that you have to comply with your monthly milestones. Hopefully, the weeks that we have left, we should be working full on regarding testing the app. Remember that the tests in the app will be focusing on this. Testing from the country apps, the interaction with the nodes. Also, don't forget that we have two phases. One is the virtual phase that begins the first week of October. I think it's the 6th or the 7th of October, if I recall rightly. I don't remember whether we're going to start on on a Monday or a Tuesday, the 6th or the 7th. And there we will be working on all the patient creation things, creating all the enablers and all the data that has to do with you as a country in order to face then the test with your peers, so that we can get to the Conectaton with a great level of maturity, much higher than the one that we had last year. So any single aspect or any little detail with creating those initial conditions can be covered then in this online virtual Conectaton, which from the point of view of the tests is going to be very good. Of course, we're going to check against Gazelle. We're going to make sure that transactions are well carried out. But the idea is for us to be able to work in this remote online space before meeting face-to-face, and that we can dedicate all that time to the interaction between the peers and using the information for both tracks. We have a new question for you, Sergio, all yours. Actually, it's a question for you, Carlos. It's actually for the IDB. As part of the organization, from Raxel, we provide the technical support for the Conectathon. It's the IDB and PAHO who are in charge of the logistics. So I cannot answer your question regarding the emails. I don't have that information now, and I do not see any of our colleagues from the IDB connected that could give us that information now. But we will be communicating this as soon as possible. So note taken, and I will ask my peers so that at least we have the date as to when the emails and the invitations will start going out. In general, according to the previous processes that we have seen, it is usually along the same dates of the registration for the Conectathon, which has been defined for September, 1 month before the event. So probably in September. But again, they come from the IDB and from PAHO, and unfortunately we have no saying whatsoever in that regards. We can maybe give you a little bit of support, but there's not much else that we can do. There's another question. Adriana, maybe you can activate your microphone. It's probably a little bit more interactive that way. Okay, thank you so much and good afternoon, everybody. I have one question. In the latest steering committee, we were told that additionally to all the technical things that we have to comply with, we must also comply with local knowledge transfer through webinars or maybe speeches from the maximum authority, stating or describing that what's being done in the project, or maybe training sessions or other possibilities also, as well as communication in social media, etc. So for knowledge transfer, local knowledge transfer in each of our countries, how can we provide evidence? For example, the speech or the presentation by the authority in the webinar. Is there a special format? Do we have to send it over an email? What is it exactly that we need to do there? Well, thank you for that question, Adriana. And again, I don't have the people from the IDB Communications Department, but I do know that generally speaking, for those activities that have to do with basically disclosing or dissemination of the content, it's very easy to be able to provide the necessary evidence. For example, when a webinar has been recorded, you could share the link and you can tell us whether it's an open webinar. Even the invitation to the webinar is part of the evidence that you can provide. If you have the list of attendees also, the typical things related to those kind of knowledge transfer event, which are the ones that we use. We record every single session. We have a list of attendees. I don't think it's going to be much more than that, but I can confirm that afterwards. I think that the same thing happens when an authority delivers a presentation. There's always some record left of that. So if you have the record, then you can share it, the attendees, the list of attendees, or the activity itself. Now, for communication, I believe that you're going to receive a kit. But again, that's not really the information that is part of my scope. We will ask the IDP, and I will ask them to see whether we can give you a full answer ASAP. Thank you. We still have 5 more minutes. Do we have any additional questions? I can tell you, we are a few days away from uploading the consolidated information to the Raxel network. We always do that, and there we try to compile the documents. We're going to be leaving the one on the use cases with these charts that are even more detailed in the case that there are any doubts. We will also give you some guidelines, because we know that helps to better understand what it is that we're going to be testing in the Conectaton. Did you raise your hand again, Adriana? Yes. I have another question. For these local webinars, can we invite some of the people from the Sense technical team to help us with these webinars, getting them to deliver a presentation by one of the Sense delegates, and then we can also have then the local team supporting or sharing the work that is being done internally. Yes, of course. It's something that we just need to organize well. So, when organizing any knowledge dissemination, you could identify then some key speakers, and of course you could request, and from Raxel, if we can provide any support, by all means you can count on it. Basically, let's look at the details of that based on what you decide, the contents of that webinar or whatever knowledge transfer activity you design. What we're doing in the Conectaton, it's basically the ones that are working here are the teams that you have seen here. And if you want something that's a little more specific of what's being done maybe in other regions, we could also get in touch with the people from the European Union, from the InfoWeb, and we also have some additional networks. It's basically the same people that have participated in this different cycle of webinars, and we can get their support. But always based on your planning, on the design and the contents that you want to deliver, to see who would be that right speaker to get. 2 additional minutes. Are there any questions, or can we bring this webinar to a closing? let us not forget that this session will be available in the YouTube channel. If I'm not mistaken, all of the previous ones have already been uploaded. There's nothing outstanding. Make sure that you double check aspects that you may have doubts with. For example, the terminology sessions. We will have updates on the terminologies, but you're going to be working with your monitors on that, especially when it's related to the vaccination certificates. We are right on the borderline. We're working with the definitions for the vaccination certificates, and that's why for the app, but also for the rest of Tracker 2 and with the Docker, we are still a little bit delayed because we're waiting and closing those definitions so that we can be as updated as possible. But of course, terminology is something also that has an impact on us. I've mentioned this already. But you will be working with your monitors on that. Let's try and close the enablers as soon as possible. I've been looking at the progress, and sure, a lot of progress has been made in the last month, but we need to close all the details on the IPS, the MHD profile, because these are the enablers that allow us to apply these new cases. Hopefully the app should be running as soon as possible, and let us not forget that the things that we're going to be testing this year, so that we can then start having only then the vaccination certificates pending, which the idea is that everything is updated so that we can create then this ICVP, which is as close as possible as defined by the WHO, so that when going into production is not as difficult. That's the spirit behind this. The spirit of the Conectaton is always to try and leave you as prepared as possible from the technical point of view, so that you can later then go into production. And we hope to be able to do that, and well, the decisions that have been made with that in mind. That's all. I don't see any additional hands up. I don't see any more questions in the chat bot. So let us carry on working. Don't forget the dates, and also the first week of October. Remember that we have this first virtual Conectaton. We'll be opening up the registrations for Gazelle. And in the coming weeks, we will give you some additional information, and then we will have all the webinars from the people from IAG, where we will be talking about this process in detail. We'll be talking about the registration, the Conectaton, what we will be testing, etc. So again, continue working, catch up. It's very little time left. Time has flown by this year. I don't know what happened, but that's the way it is. So let us move forward to make sure that we have a wonderful Conectaton this year again. We're testing some things mentioned by Sergio that conceptually with the IPS are quite innovative. We're trying to go one step beyond from what we have seen in other regions, which we believe can be very, very helpful for us. Consolidating the IPS is highly conceptual. We're trying to follow the standard, although the IPS is nothing but a snapshot. We're forcing the standard just a little bit, but also respecting it so that it's useful in terms of the continuity of the care that patients receive. So it's going to be quite new, but we believe that it's going to be a good contribution from the region to the globe. So let us keep on working in these aspects that are part of our idiosyncrasy. So be well, and we will see you next week with a new webinar, and I believe that from this week on we're going to be having webinars every single week. Maybe in September we're actually going to have 1 week with 2 webinars because we have no more Thursdays available that we can go to before the Conectaton takes place, but we will inform about this promptly. Thank you once again, Sergio, and we will continue sharing the links over Slack and the official channels. Be well, see you next Thursday.
Hasta luego. Gracias. Que estén muy bien. Hasta luego.
Gracias, buena tarde a todos.
Adiós.